First, you have to understand what a lot of my patients understood is, how do you actually quit smoking? So with my patients, I always ask a very simple question. What makes you a smoker? No, seriously, if we go outside right now and I have a cigarette and you don't, am I the smoker now? No, that's not how that works. So it must be something different. And let's get something straight. We're all in agreements on the negative impacts of smoking. And that drives me nuts when people just try to say, oh, you should quit smoking because of all these negative things. People who are smokers don't disagree with that. They understand that there's a tremendous amount of negative health benefits that come along with smoking. I've never had a conversation with someone who said, well, I think all that cancer stuff's overrated, doc. I really think we should take those studies back into account. No, that's not how it works. People who are smokers don't want to be smokers. But even though we're all in agreement on the negative effects of smoking, we disagree on one thing, and that's the benefits. And someone who's a smoker thinks they're getting a benefit from smoking that everybody else just doesn't think is there. Now I'll say this, even though we all know the negative effects of smoking, all the terrible things, probably the best explanation I've heard is from a dentist. And the dentist was explaining the mouth tissue that you have is like this superhuman tissue. And when you eat, you get small cuts and abrasions inside your gums and next to your teeth all the time. And your tissue heals it extremely quickly. But when you smoke, it inhibits something called neovascularization, which is the building of new blood vessels. And so you can't heal as well. So it takes that superhuman tissue that you have, and now it's just regular tissue. And regular tissue doesn't heal quite as well. And now you're more at risk of infections, and you see those cuts a little bit more. And any smoker can tell you, they don't heal very quickly. As a matter of fact, plastic surgeons won't operate in many cases on smokers because they know the healing is so poor. And there's certain procedures for your spine that insurance won't pay for if you're a smoker, because if you can't heal, your risk of infection is too high, and they won't pay for that because if you get an infection in your spine, that's a dangerous thing. We know that that happens for smokers, that they can't heal and they can't build new blood vessels. And so that's the same thing that happens in your body, is all the cuts and all the damage that you get over the course of your life on the inside of your blood vessels. That thin inside layer is like tissue paper, and when it gets cut and it gets damaged, instead of getting healed, now we got to fill in with cholesterol, and now your body has to repair that, and that's where that acceleration of plaque and atherosclerosis comes from. So you have to let your body be able to heal itself. It's one of the most fundamental things about preventing diseases long term. If I go home right now and my house burned down and my wife left me, I'm not going to go get a cigarette because I don't think there's anything there for me. I don't think it's helpful. It doesn't matter if it's been 2 weeks. It doesn't matter if it's been 2 years since the last time they had a cigarette. If they still think there's a benefit there, that when that stress happens, it outweighs all those negatives in their mind and they'll go back to smoking. Now, for starters, if this is your first time quitting smoking, great. If it's not successful, that's okay. On average, when I talk to patients, it takes them about 5 to 6 times before they're completely successful at quitting smoking. So if you're just getting started, your first time, there's no reason you can't be successful. But if you're not, don't give up. Keep trying. So let's get down to the fundamental problem. Is this benefit that you think you're getting? Now, granted, some of that is dopamine. When you smoke a cigarette, you do get a rush in your nervous system. It specifically stimulates a couple neurotransmitters in your brain. So we think primarily acetylcholine, norepinephrine, and dopamine that get elevated. And your brain only wants one thing, and that's dopamine. So what we have to do is stop telling your brain that you can get dopamine from cigarettes. You spent your entire life training yourself that cigarettes are good and they're going to give you dopamine. It's kind of like a dog, and you give your dog a treat after the dog doesn't want the dog to do. So stop giving the dog treats when it does something bad. You have to start retraining your brain, and that's when you quit smoking. Your brain doesn't want to go for something that doesn't give any sort of reward. So you have to take the reward out of the equation and start giving your brain a positive reward. The most important thing is stop telling your brain that you're getting something from smoking. There is nothing that you're getting from it. You're getting a dopamine hit, and your brain wants dopamine from anything you can get dopamine from. So stop telling it that smoking is a viable option and nicotine is the way to get that dopamine. Once you break that link, that's what makes you a non-smoker. That makes a lot of sense because triggers for people to smoke is stress, when they feel bored, and anytime your brain can whisper in your ear, hey, a little dopamine would be great. Look, just a little bit of dopamine would be pretty helpful right now. And that's never going away. So what you have to retrain is your brain not to want the dopamine from cigarettes. So the first thing you have to do is start training your brain that cigarettes are bad. Now that sounds kind of funny to say. You never thought that cigarettes were good in the first place, but you did have to work at starting smoking. The first time you smoked, you probably coughed a lung up, you felt lightheaded, you felt dizzy, and you have to overcome that. You have to work at it to become a smoker. And so it doesn't just go away. You have to now untrain your brain and tell your brain that this is bad. So let's try this. Close your eyes and picture a cigarette sitting on the counter. You can see the long white end of the cigarette. You can see the filter. You can see a lot of those little white components of the filter. Now, I want you to picture that cigarette sitting there, except a lot of small bugs start permeating out of both ends of the cigarette and they start coming out of the filter. If that was really happening, would you still smoke that cigarette? No, I don't think you would. And your brain can have this negative association now with cigarettes where you're not going to want that. You're going to wait. Even if you don't have another pack, you're going to throw that one out and you're probably going to go find something else to do until you can get another cigarette. So you've effectively trained your brain that you don't want that cigarette. So now we need to start looking all cigarettes that way. So what changed after you saw those bugs coming out of that cigarette? Your brain then made a connection that it was bad, that you didn't want it. So you have to start reinforcing that in your brain. Tell yourself you don't want it. When you get that urge, pause for a second and say, do I really want a cigarette? No, I want a little dopamine. I'm a little stressed. And a cigarette, interesting enough, doesn't fix that. It gives you a little bit of a bump, and then you're gonna have a dip of dopamine after that recovers, and then you're gonna crave another cigarette. People who don't smoke don't deal with that up and down all day long. They just have a steady state, and they don't have to deal with these cravings all day. So you have to start telling your brain, I don't want the cigarette. What I want is a little bit of dopamine. You can get that from taking a couple of deep breaths and standing up and stretching your legs and walking around. And then that craving for dopamine will eventually subside. And then you'll get to the point where you've stopped that association between smoking and dopamine. And interesting enough, what should you replace it with? And that's the more important question. You gotta give your brain the reward it wants. Your brain wants dopamine. Your brain wants a reward. So you have to give it to it. And the most important thing that you can do is be happy that you're a non-smoker. Instantly, even if you just started 2 seconds ago being a non-smoker, you've learned that there's nothing that smoking is gonna give you and there's no benefit from that cigarette, be happy about it. You have to be excited. You have to be telling your brain that this is a good thing. Every time you see somebody smoking on the street, don't say, oh man, I wish I'd go for a cigarette. Be, man, that person wishes they were me. That person wished that they quit smoking a long time ago like I did. I'm so much happier that I don't have to deal with the cost. I'm so much happier I don't have to deal with the smell. I don't have to listen to my friends or my spouse complain that I smell like smoke. I don't have to listen to people tell me to quit. I'm done. I'm officially just done with doing it, and I'm so happy about it. And that's when you talk to those people who are actually done smoking, they can't even stand the smell. They don't crave it anymore. They don't say, oh man, I really miss it. They're done and they're happy to be done. So if you want to be a non-smoker, be happy to be a non-smoker. So after we finished the conversation, my patient was like, oh my gosh, that makes so much sense. I got 2 buddies that quit smoking about 2 years ago. And my first buddy, I go over his house. I walk in and I smell like cigarettes and he says, God, dude, I wish you could just like not smoke in the car. Like your jacket smells like it. I can't stand that smell anymore. The second buddy, when I go to his house, he goes, man, if my wife wasn't here, I'd love a cigarette. That second dude is still a smoker. He's just been doing a really good job of avoiding smoking for 2 years, but he still thinks that there's a benefit that he's gonna get. Now, when I talk to a smoker in my clinic, the thing that I'm actually calculating in my head is how many years until I need to start screening this person for lung cancer. We put that threshold now at about a 20-pack year smoking history. So 2 packs a day for 10 years, a pack a day for 20 years, half pack a day for 40 years, you get the idea. At about that 20-pack year history, if you're over 50 years old, you're healthy enough to undergo treatment if we do find something, you've been a current smoker within the past 15 years, then we should do a CT scan, a low-dose CT scan to screen for lung cancer on a yearly basis. Now, we don't need to do that for everybody, and I don't suggest for every person who's a smoker, but in my head, when I'm talking to someone who's, we'll say, 40 years old, and they've been smoking a pack a day for the past 10 years, they started when they were 30. In my head, I'm thinking, in just another 10 years, that person's gonna be high enough risk to be screened for lung cancer every year. We need to start looking for it. In comparison, if that person who's 40 quit smoking that year, then 15 years down the road, not only did they never need to be screened for lung cancer, but they're out of the window of where we're concerned about that increased cancer risk. Those are the decisions you have to make, and then realize that this smoking trajectory is gonna keep going. And you may have just been smoking for a few years now, but you don't want to get to the point where you've been a 20-year smoker. The time to quit is always now. You need to start the clock on the non-smoking component of your life and start accumulating some of that decreased risk instead of continually escalating risk. So the rate of quitting smoking, if you quit cold turkey, is about 5%. If you use nicotine replacement, that maybe doubles that. If you're using a medication, it jumps up about 20%. And if you're doing hypnosis, it's a little bit better than that, but still nothing above about 1 in 4 people, 1 in 5 roughly, who quit smoking with each attempt. So when would I use medication? When would I use nicotine replacement? When would I tell somebody to try cold turkey? I think it kind of depends. In general, I would put that line at about a half pack a day. As far as quantity goes, less than a half pack a day, you could probably just quit cold turkey and not have to deal with like significant withdrawal symptoms. Over a half pack a day, some people consider weaning down on them. You get to a half pack a day, you're kind of within striking distance, you can just cut cold turkey. I think that's reasonable, and without expecting a tremendous amount of withdrawal symptoms coming from it. As far as medications go for quitting smoking, my favorite is probably bupropion, otherwise known as Wellbutrin. This is a once-a-day medication that you can use at 150 milligrams or 300 milligrams. It's interesting because it works on the same 3 brain chemicals or neurotransmitters that nicotine does. So a lot of people will say, I still kept smoking. In this medication, you can smoke while you start taking the medication. And people come back and they say, I kept going outside, I kept going for smoke breaks, and I just didn't want it. Like, I was lighting up the cigarette and I just put it out. Like, I didn't want it anymore. It was really strange. And essentially what they're finding is when they don't get that dopamine surge from the smoking, then they don't want it. So again, that goes back to the fundamental problem is you're telling your brain you can get dopamine from smoking a cigarette. As far as Chantix goes, I've had just way too many patients have like hellacious dreams on Chantix. I've had a few patients that love Chantix and they quit smoking with it and it worked great for them. More often than not, I have people who say they have very vivid, disturbing dreams. If you do try Chantix, I'm not saying don't try it, but just be aware if you have that side effect, that wouldn't be uncommon, and you can stop it, and that discontinuation will cause the symptoms to resolve on their own. There's nicotine replacement. I've not had much personal success with patients who have done nicotine replacement. Most of the time, patients will tell me that they just continued to use gum for a while. It can upset their stomach because they're swallowing a lot of that nicotine and give them some stomach upset. So be aware if you have that side effect from gums. Not the same with patches. Also be aware there is a conversion rate. You don't just go from 2 or 3 cigarettes a day to a full-blown patch that's made to help somebody who's got the level of nicotine for like 2 packs. So be aware that there's different doses.